Mr. Johnson, my name is Colton. Dr. Smith has given us an order to check your blood sugar and give you a shot of insulin. Do you mind verifying your name and date of birth for me? Great. So to get started, I'm going to wash my hands and put on a fresh pair of gloves. And Mr. Johnson, can I help you wash your hands? Okay, great. And at this time, while he's drying his hands, I would put a testing strip in the meter to cut it on. And while it is powering on, I would look at his fingertips using the lateral or distal side of the finger pad and a clean alcohol swab. Using myself as an example, I would clean the fingertip and using a single-use lancet device, I would place it flush against the skin, press to allow the needle to insert, drawing up 1 drop of blood and wiping it off with a clean cotton ball and getting that 2nd drop of blood to test on our testing strip. So now that it is reading, it is red, your blood sugar is 210, so I'm going to take this out and cut the machine off and sanitize while it is being cleaned and drying per disinfectant protocol. I'll take my gloves off and explain to Mr. Johnson, you do have to get a shot of insulin today. I'm going to clean my hands again and get started on his insulin. I will verify on the vials to make sure that they are in date and marked accordingly and that they are good and that they are on the MAR as to what he has been ordered. Dr. Smith has ordered you 5 units of NPH, which is your long-acting, and 5 units of your fast-acting insulin. And I will take it, since they are the appropriate one, I'll make sure that the NPH is dissolved because this one likes to settle. I will clean the tops of the vials with a rubbing alcohol pad and pull back 10 units of air, inject 5 units, being sure not to touch any solution in the NPH, and then 5 units in the regular. Pulling back 5 units of the regular and 5 units of the NPH. At this point, I will scoop method to recap my needle. I will mark accordingly using a piece of tape to identify it on the patient's syringe. Verifying, I would mark, take my gloves off, and at the bedside, wash my hands too, but at the bedside, Mr. Johnson, so we're going to do a shot. It looks like your last nurse gave you a shot in your right upper abdomen. Is it okay if I gave it in your left upper abdomen today? Okay. Sites that we can administer insulin in are our abdomen, our subcutaneous tissue in our arms, obviously subcutaneous tissue in our abdomens, and subcutaneous tissue in our thighs. I'm going to go for the abdomen today. So, Mr. Johnson, is this okay? Is this all right? Do you mind verifying your name and date of birth for me one more time? Great. And at the bedside, I verify on my ID marker, this is 10 units with my MAR. He receives 10 units, 5 units each of NPH and a regular acting insulin. I will take a clean alcohol swab, clean the site in which I'm injecting, allow it to dry completely, uncap the needle, pinch the skin together, inject the syringe at a 90-degree angle, inserting the medication slowly, withdrawing and disposing of my syringe in a biohazard sharps container. I will place the alcohol pad back on top just to make sure there's no medicine that comes out and he's not bleeding. And that is it. At this point, I will take my gloves off, make sure he tolerated it well, sanitize my hands one more time, document location, site where it was administered, and